are trying to get everyone in the industry to think of not what are we doing, but what could we be doing? What are the problems that we see both today and in the future in healthcare? And what should we be doing to best address those problems?
And the way that we look at it, our vision is to be a leading and world-class digital health service provider, not just within the continent, but across the world.
We try to build technologies that are immune to the infrastructural challenges in this market to ensure effective storage of temperature-controlled products, which could either be fresh agro-produce or it could be vaccines, oxytocins, insulin, and other healthcare products that affect human lives.
Students are able to access models of the things that they study. For example, engineers are able to access a virtual lab, and medicine students or high school students taking biology are able to access different parts of the anatomy through their mobile phones.
So working in an African country, I think accessibility to health is the most impactful project that we can do it, because we are disrupting this health market, making more transparent and less asymmetric.
We are rolling and we are going in 3, 2, 1, and action.
Go first or me?
Go first.
Okay.
Our core offering has always been about helping patients avoid unnecessary hospital visits. And obviously that's something that is still quite important during this time, even more so in the time of COVID. So the core part of RedBird hasn't necessarily changed, and sometimes it's hard to really judge that anyways, because startups change so quickly if you're doing things right, honestly. But I think what I've seen is the way we operate has changed. We had to make some changes due to the pandemic, and it opened our eyes to other changes that we might want to make just for improved service or better efficiency. So we've grown a lot, but the core of what we've been trying to do at RedBird didn't shift that much in the end. So RedBird's very focused on the future and the future of healthcare, and so we are trying to get everyone in the industry to think of not what are we doing, but what could we be doing? What are the problems that we see both today and in the future in healthcare? And what should we be doing to best address those problems? And so in RedBird's case, we look at the future and we say chronic disease is exploding as a huge health burden, and that's going to change a lot of things. It's going to mean what we're doing today isn't going to cut it if we want to give people the health care that they deserve. And so we see this way leveraging community pharmacies, leveraging rapid diagnostic testing, and really just focusing on convenience as a way of addressing the problems of today and tomorrow, creating convenient options for healthcare, because that's really important.
All right, let's...
For us, it's even more incredible that we are here post-pandemic. We were in the middle of raising our seed round. It was a tough period because just when you're about crossing that, now people are like, okay, pandemic, investors are looking at what they need to do. How can we look at that? Credit to our CEO, like he guided the team, like really through it. Throughout the pandemic, we had to go on lockdown and still engaging with investors and other level trips that we had to do, meet investors that were all of a sudden canceled. But we managed to steer through that. And I think the resilience that we showed actually catalyzed our fundraising for the seed round, because once we went to lockdown, most companies just didn't figure out what to do. Like RedBird was still running. We're still making numbers, even though we're challenged. Once the lockdown went off, like we were able to rescale back to pre-pandemic levels, and that gave a lot of investors also confidence on the things that we did. I'm not sure I'm allowed to say this on camera, but people sacrificed so that we laid no one off. No one had pay cuts, nothing. The team was working totally on that. So
there were growth decisions or investment decisions in terms of, not investment in terms of the raw cash, but just do we head in this direction or do we head in that direction? The biggest question for us is, pharmacies are where we believe the most valuable convenient care point exists for decentralizing healthcare, which is our vision. Obviously, pharmacies themselves have challenges with COVID, and do they want all those people coming into the pharmacy having close contact with their teams and their employees? And so I think the hard decisions that we kind of had to make was thinking, does this model work in an ongoing pandemic? Those were kind of the tougher decisions. I don't think we were ever pushed to the point where we were like, we have to radically change the core business or things like that. But we certainly had to be smarter about how do we get pharmacies up to the point where they can basically continue to do what we hope that they would do while in the middle of a pandemic.
RedBird has taken leadership. I've been a pharmacist nearly 8 years now, and I've seen the expansion of RedBird and how it has created an impact in the pharmaceutical sector particularly. A lot of patients come in, make here their first point of call without informed decisions. RedBird has taken the leadership. There is no other platform that is doing this appropriately organized. Our customers have truly been satisfied, particularly with the features of the apps on their mobile devices. No longer will doctor referrals to do a weekly BP assessment become a headache for them. When they come, they see the results on their phones, and it trends in a graphical representation. So the doctors and then the clinical team, with that tool being sent on their mobile devices, are able to make a quick assessments, whether it's trending high or it's trending low, and they can make informed decisions to their. And people that often take malaria medications without testing, today we can confirm or deny their feelings and tell them what may be truly wrong or what is happening in their systems.
We have had great success growing here in Ghana and really proud of the network we've built here. But from day one, we knew this needed to, and we wanted it to grow beyond Ghana. We want this to be synonymous with convenient healthcare across sub-Saharan Africa and potentially even way beyond that.
My name is Davis Musunguzi. I'm the Managing Director of RocketHealth. What RocketHealth does is provide a telemedicine and last-mile healthcare delivery service. What that really means is that you can be able to talk to a doctor and get a consultation over your phone. You can use chat, you can call in, you can use video, and we'll be able to interact with any one of our doctors. If you do need a lab test to confirm your diagnosis, we have our lab team that will come to your home, work, or school, pick your sample, bring that into our lab, we can run the tests, and the doctor will call you back to explain your results. And if you need any prescription medication, we'll also have that delivered to your location, and we'll follow you up to make sure that you have the best possible outcome with your treatment plan. We also have an online e-shop, so people can go to rockethealth.shop and be able to order these same services online, or even if you have USSD, you can use *280# and be able to order these healthcare services. So we first conceptualized the idea of RocketHealth back in 2011, 2012, and we thought at the time that surely with the increased number of smartphones and the penetration of the internet, that there was an opportunity for us to use those technologies to be able to deliver more healthcare to more people. So around that time is when we started out experimenting with a medical call center staffed with doctors and pharmacists operating 24 hours, 7 days a week. And we noticed that the traction and the impact was exactly what we desired, and we decided to scale it up even much further. So in that way, I think we have also adapted. We got a lot of demand from clients in the very early days to not just do a consultation, but then to also add the lab service, to add the pharmacy service, and we've really evolved over those lines. But then also still some patients need to be seen physically, so we have a clinic where we see patients that need to see any of our specialists, whether it's a pediatrician, psychiatrist, a physician, and so on. The lab service has been one of the most impactful services that we have had over the last year or so. And ever since the pandemic started, it created this demand for COVID-19 testing. At the time, in the very early stages, there was very little supply of kits for PCR. But then as time went on and kits became more available, and you also had what you call antigen tests, which are more rapid tests, also become available, we started making that service available at RocketHealth. So what would happen is that if somebody had symptoms, they would call RocketHealth or use USSD at *280#. We would send over a lab technician, pick their sample, bring that back into our licensed lab, have our team run the results, and then get back in touch with the patient if they have a positive or negative result. And also travelers, we also have travelers who are using the PCR testing to be able to confirm their travels. And the way that we look at it, our vision is to be a leading and world-class digital health service provider, not just within the continent, but across the world. We're going to make sure that we have the right expertise, the latest technologies. We're going to make sure that we have the necessary capital and financing to be able to do that. Because I think if you have a mix of the capital, the smarts on your team, and also you really are solving your problem in the market, it's really just a matter of time and scale before you're able to become that global enterprise that we need to see out of Ugandan companies. Healthcare for the Africans has always been a problem. 25% of the world's disease burden is in Africa, and yet Africa only has 3% of the world's doctors. So there's this huge mismatch between our disease burden and our capacity to be able to resolve all these ailments. If you're looking at the technology space particularly, I'm very keen on grooming software developers. There are a lot of challenges in healthcare that can be solved by technology, but really what they need is having somebody help them identify where the greatest need is, just helping them map out how healthcare actually works, and helping them integrate technology into where those problems actually are. So I think a lot of that is what I help direct tech innovators to be able to do. I would say the other area is really also around data analytics. We sit on so much data within the healthcare sector, and I think we barely scratch the surface of what is possible in terms of being able to analyze it, use all these kind of informatics technologies to be able to predict what's going to happen next. And I think more than ever in the middle of a pandemic, data analysis for healthcare data is extremely important, and we're focused on mentoring and building capacity within our mentees around areas like that. I think what we have tried to do is to really change the patient experience, transform the patient experience so that you can be able to get healthcare regardless of geographical location. You can be able to access that on your mobile device, which has a very high penetration amongst Ugandans right now, and that services can find you where you are. And within that, we can be able to find some efficiencies on cost, on time, that really make healthcare a much better experience for lots of Ugandans.
From around the world, let's go!
Health, wellness, sport, beauty, medical breakthroughs. Healthy Living cares about your well-being. What are the main health concerns in Africa and around the world? Find out the latest on coronavirus. Connect with our experts and ask them questions.
How long does the virus stay?
Join me, Lino Khmudu, in Washington, every week on Healthy Living, right here on VOA.
Currently, we're working on an educational project that provides a solution where students are able to access models of the things that they study. For example, engineers are able to access a virtual lab, and medicine students or high school students taking biology are able to access different parts of the anatomy through their mobile phones. Actually, the virus served to push for our product because we started our startup last year, and with us having to learn at home and not having access to our labs and practicals, then we thought, how about we access our labs from our phones? So that is when we started augmented reality, because with this you can be able to access different machines, and we're also creating a model now for other students taking medicine, for example, where they're able to access different parts of the human anatomy and be able to manipulate them and see the different labeling of the parts.
The idea with IPop is to have, when a student is reading, the idea is to have the 2D image to pop out of the book and be just in the world, so that the student can actually feel immersed with the education. So that's where the idea came from. We saw a niche in the education sector where students are just reading and you see a 2D image and you don't actually quite get what it represents. Maybe during a class lecture, the teacher just draws something and you don't quite fully understand it. So the idea was to have 3D images pop up and you can rotate them, you can see labels, and yeah, we know that that will actually improve on education. So this product, in 5 years, we anticipate for it to have grown in, when students are talking of learning, they have this product in their homes. So when doing their revisions, say they need to finish a lab of some sort, they can actually have the experience at the comfort of their homes. No need to wait for schools to resume, no need to wait to go to class and queue, congest in the labs. These things will be at the comfort of their home, just with their mobile phones. So technology is really key in improving human life.
Do you party? Do I party?
Yeah.
Sometimes.
And you dance. Yeah.
Hi, my name is Yotumogen Etega, and I'm the founder at GRICD. At GRICD, we're focused on technologies that help improve the cold chain space, targeting 2 sectors, healthcare and agriculture. One of the fundamental core values at GRICD is to ensure continuous improvement. It means that the team member needs to listen to the customer, needs to pay attention to the process, and needs to improve on the customer experience and the customer's process, basically. At the inception of the business, what we've always paid attention to is also the zeal over the skill. So recruiting people who are hungry for success and hungry to also satisfy customers above people who have the skill, because skills can always be learned, but attitude is at the helm of the recruitment strategy which we have at GRICD. If you look at the African landscape today, you see that sub-Saharan Africa basically has one of the major challenges when it comes to agriculture. You have about 200 million people that are undernourished, and if you look at vaccine distribution for children, you see that in places like Nigeria, 20% of the population do not have access to vaccines. The major cause of this is actually due to the lack of supporting infrastructure for distribution, and that's where we come in. We try to build technologies that are immune to the infrastructural challenges in this market to ensure effective storage of temperature-controlled products, which could either be fresh agro produce, or it could be vaccines, oxytocins, insulin, and other healthcare products that affect human lives.
Basically, how you operate the device is by pressing the button on the battery. After that, you press the power button on the panel at the top of the device, and it takes about some seconds to boot, and then you set whatever set point you want it to. You want the temperature to get to, and then you press the settings button to save that set point, and the compressor comes on and cools until it gets to that set point. When you are running at maximum capacity, that's at when you want it to get to about -20 degrees, is about 4 hours. But when you want it to be about 2 to 8 degrees, which is like the normal temperature range for vaccines, it will last up to, for about 8 to 10 hours. The solar panel helps prolong the lifeline of the battery. When you have to go into remote areas, that will take about 10 hours to get to without any source of electricity, you have the solar panels to come in to back you up, so the products that you are moving to such locations remain potent.
With the swappable batteries, You could take as many batteries with you on your journey, and then when the battery dies off, you just swap it. With what you have in Nigeria and many other developing countries, electricity is a challenge. So we've seen that you are not even limited by that in transporting vaccines or very temperature sensitive materials. The batteries, the boxes, I mean, are trackable. So they have a mobile SIM embedded in them. And with that, it's able to send data to our servers, and then we're able to monitor the location, the temperature of the materials that are stored in the boxes.
Good afternoon. Good afternoon. I'm a rider, Michael. I'm here to pick an order.
Before we refer patients to the lab, but now when they came here, they make the job easier for us in taking the sample to the lab, and it's easy our service delivery.
We are Greg and
My name is Daniel Cohen. I'm partner and product manager at Appy Saude.
Hello, I'm Clara Vieira. I'm in Appy since 2017. That was the year that Appy Saude was launched as an app, a mobile app. And I am a marketing director and a user satisfaction director.
Appy Saude is basically a healthcare platform that allows anyone in Angola to find and order pharmaceutical products online, and at the same time schedule meetings with doctors. And what we did is actually allow something that wasn't available in the market. Not even at Google. You would search for information or a hospital or a doctor or a specific specialty. You wouldn't find anything. And basically that was the drive for us to start this project, because there was an actual need. The project actually started in 2015 around, and there was a kind of pilot where we collected information in Luanda, like for pharmacies, health clinics and hospitals, and we put it available on an application, mobile application. However, it was self-funded and it was very limited, but it actually allowed us to search for more investment. So we knocked some doors, and this allowed us to first commit full-time at the project. That is very important, because some people, I believe that it's possible to implement something like this working part-time, but not. So we started working full-time at this project, and we were able to release the first version of the app 2017, April 2017. And then we started releasing products. The main challenge is that not only the person that is ordering online that needs to learn about it, so you have a lot of investment on communication, and then you have a lot of investment on communication also with the partners that you work with, because they also need to learn about these new skills. It's where we invest a lot of energy, and at the same time requires more from us in order to actually grow and scale.
World is moving fast. Angola is also moving fast. And you want to do the things for yesterday, because you need to show a new thing you have in your platform. You need to respond to your user. You need to find a product that is not online yet. You need to put all the products online on the same time. But we are small because we are a startup. We are growing up very fast, very well. But we need more people to have more time to do all the things. Learning is opportunity. When you're not doing just one thing, just one job, you learn a lot, and you understand everything about your platform, about launching, about IT, everything. So this is opportunity, because you are a startup and you don't have all the team yet, you don't have a designer yet, you don't have a copyright yet, so you do everything, and then on the end, when you have results, is all yours. It's all on you.
In a country like Angola, yes, you still have a small market, so the opportunity is still that most of it is open, is not yet tapped.
60,000 downloads, 25,000 active users every month. People returning to our platform, people saying that we are the best service in health that they ever used. It's not about just being the best in Luanda, it's about being the best in the country, it's the best on the continent. So every user, every time someone open your app and make a purchase and get the product, get delivery a product, every time a mommy finds a baby milk formula, every time a sick person finds her medication, every day we have a reason to celebrate.
Basically, we had this strategic goal in 5 years. We would like to be in major cities in Africa. We feel like some issues that we are tackling in Angola are somehow similar to other places. And big cities represent, like for example, Luanda represents roughly between 70 to 80% of Angola's economy. And the same thing happens with other African countries. So we feel like with the product, if not the same, similar, because of course we are adapting and learning with the process to provide more value to users and also to pharmacies and healthcare professionals that need an incentive to be in the platform. But yes, so it would be this goal.
We join all the information at the center and we empower people with that. They can use, they can see in a mobile app, in a computer, they can choose, they can compare prices, they can compare the products and they can buy it online with a click. And then click and collect, get delivery, all the service, everything about health in just one small icon that you can have on your phone. That is our app, is ours proud, it's ours happiness.